Dr. Ortiz, what is type 2 diabetes?
Type 2 diabetes is a very complex disorder. It basically involves a basic genetic predisposition to developing diabetes from your family history. And then you add on top of that a lifestyle that may be poor in terms of diet, in terms of exercise, in terms of activities. But essentially, diabetes is a relative lack of insulin or lack of insulin. There's type 2 diabetes, which basically occurs in adults. And what happens is the insulin that's being produced by your pancreas usually comes to the cell and opens the channels so that sugar can flow into the cells. And therefore, they can use that glucose for creating energy inside the cell. If the insulin is not available or is not working well, the sugar runs up against closed channels and it accumulates into the bloodstream. And that's how come the blood glucose levels go up, because they're accumulated in the bloodstream. And that is dangerous because that sugar now sticks to the cell walls, the proteins in the cell walls, particularly in the vasculature, which creates inflammation and creates other problems. Diabetes is the precursor for heart disease, stroke, vascular disease, neuropathies, blindness, and kidney disease. So it has a lot of consequences. And we measure it really by your blood sugar levels in the fasting state, the postprandial state, but also the A1C. The A1C is very critical. Hemoglobin A1C is very critical to understanding that how much glucose is being stuck to the red cells gives you an idea how well your control has been over the last 90 days and what you may need to do in the future to prevent the complications of diabetes.
That was very informative. Thank you, Dr. Ortiz.